common mental health problem in the United States, and it's affecting our children. In a classroom the size of 33 children, one child is likely to suffer from depression. That's children. Now, for teens, it's more likely it's 1 in 8 who may suffer from this disease. So with us today, Dr. Wendy Anderson-Willis from Nationwide Children's Hospital, our pediatrician friend, here to help explain this to us. And I think our first question, I guess my first response was, wow, those numbers seem really high, especially the teen numbers.
We're seeing lots and lots of kids with depression. The good news is, though, it is temporary in most cases and it's treatable. So we're doing everything we can to screen and find, those incidences where we do have kids who are depressed and do something about it.
Are our kids depressed because school's harder, because of technology, because their parents are a mess? Why? Yeah. Why?
It's a complicated world, and many children live in situations that are just unthinkable, with parental death, parental depression, poverty. There are many, many issues that kids deal with, and it can cause depression.
Does social media contribute to this depression, do you think?
We do find that kids who are depressed, who are isolating themselves, may be spending more time on social media. So I'm not sure if it's a specific cause of it, but when we do find kids who are obsessed with it, they do tend to have more symptoms of depression.
Okay. So, yeah, how do you know? How do you know if your child is that child who's depressed, or if this is your typical teenage mood swing thing, or what?
Well, it's very different in different age groups. So a younger child may just have physical complaints. My stomach hurts, I don't want to go to school, my head aches. Different complaints that they may have. They may be more irritable. You may know a decrease in grades. For that teenager, you may see different things. So they may not eat as much, or they may eat all the time, or you may see them sleeping and sleeping and sleeping. And, sometimes we just don't realize as parents, and we think, oh, they're just going through a change or something like that.
Well, as you look at these teen symptoms, this seems like every teenager I know and the teenager that I was. Yeah. So what's the difference between just being...
Where's the concern come in?
I think when you put all those things together, that the child may be crying more, that the child may feel helpless and hopeless and worthless, and they may feel like these feelings that they're having are never going to end. And many times as parents, we don't ask those questions. So I think it's important when we see some of the symptoms or the grades going down in school, those things that are very clear to us, behavioral changes, and we're like, they're just not being themselves, that we should see our pediatricians and get more information, get them evaluated.
And once evaluated, what's the treatment for something like that?
There's some great treatments.
Okay.
So if it's milder depression, it may just be therapy that they need. If it's more moderate depression, we usually use therapy and medications together. And then if it's very serious, it's hospitalization.
Okay.
It's interesting to know that. I didn't really ever consider this when my kids were coming up, and I don't think there was an issue, but I wouldn't even have gone there, I don't think, in my head.
Well, not with the little kids.
No.
Right.
Maybe the teens, but not the little kids.
I think it's very hard for most parents to pick up on, and when we see our kids for physicals, when we as pediatricians see our younger children, we're asking those questions. How are the grades? Are they better than usual? Are they worse than usual? What's going on with sleep? How are we eating? We're looking at those growth curves. So we're doing a lot to make sure that we screen each and every child. We even screen moms who've had babies, because we know that postpartum depression is going to affect the health of that baby. So there are lots of things that we're looking for when you come into our offices.
I think you made the key phrase at the end of that, come into the office. You need to be seen by a professional if you feel this is going on in your home.
Absolutely, and there's something we can do about it.
Should we be talking to our teachers too? Should we have that discussion about our child and how they're acting at school?
Definitely.
Okay.
I would say so.
Okay, because they're probably looking for some of the same signs and symptoms, I would imagine.
And we communicate so much with the schools as pediatricians. We communicate with them. So
oh, do you? I didn't
we do,
realize that.
actually, yeah.
Okay, it's good to know. Well, thank you so much for being here.
Thank you.
Appreciate it. All right.
Coming up, everyone, it is a big week for Crew Day.